The ICARE study was a randomized, controlled phase 3 trial that examined the effect of 3 different types of interventions on motor recovery after stroke. Our study was a sub-study of that, in which we examined whether treatment effects varied according to certain pre-stated genotypes. What we found out was that one of the 2 genotypes, the ApoE4 polymorphism, was significantly related to outcome for both of the endpoints used in the ICARE study. Specifically, persons who have ApoE4, which is about 20% of the population, which we know is associated with significantly increased risk for Alzheimer's disease and earlier Alzheimer's disease. At that, the presence of that same genotype was associated with significantly poorer motor recovery over the 1 year that the study followed these people. Many of the key scientific questions in stroke recovery and rehabilitation are at an early phase. And one of the larger examples of that is the ability to predict how people are going to do, the ability to prospectively subdivide people into those who will have a very good course and those who will have a lesser course. The knowledge of that kind of stratification or prediction would allow us to concentrate different kinds of efforts or strategies or resource allocation. I don't know what that would be yet, but the first step is to be able to tell one group from the other. The genetic factors were not a massive component, but they were a significant brick in that wall. And so perhaps one day, as the fuller picture of distinguishing patient subgroups comes into focus, such genetic measures will be a critical component of anticipating a patient's course and assigning them to the best therapies for their situation. There's a couple answers to that question. On the one hand, this study recruited people beginning 2 weeks post-stroke, and on average they were about 6 weeks post-stroke when they came in the study. And stroke is such a heterogeneous process that one is hesitant to extrapolate too far beyond the bounds of this study for the general stroke condition, although it does begin to hint at differences that may be important very early on or very late. On the other hand, one interesting note was that people who had ApoE4 who were destined to have somewhat but significant less gains over the year were not the same at baseline compared to people who lacked ApoE4. One important distinction is they were on average about 5 years younger. And so in terms of broad implications, it might begin to make us think about how an ApoE4 stroke may be fundamentally different from an ApoE4 negative stroke, much as ApoE4 Alzheimer's disease may have a very distinct biology from ApoE4 negative Alzheimer's disease.